Hey everyone, I'm Brian Jaros and I'm coming to you live from ACR 2025. Today I'll be talking to you about Abstract 1713. This was a group that looked at delayed diagnosis in psoriatic arthritis and how that affected patients' imaging outcomes. As we all know as rheumatologists, it's never easy to diagnose our patients. They present in a lot of different ways, and it's always keeping us on our toes with a high level of suspicion in order to make the correct diagnosis and get our patients started on treatments. Psoriatic arthritis is no stranger to this, and compared to something like rheumatoid arthritis, which has biomarkers that can aid in our diagnostic kind of armamentarium, psoriatic arthritis may require a higher level of clinical suspicion in order to make that diagnosis. And of course, there's concerns that if we're not making the correct diagnosis efficiently enough, patients, of course, are suffering from a clinical standpoint. And there's also been concern from a radiographic standpoint that patients may accrue damage over time that we'll have trouble reversing. This has been shown in other disease states like spondyloarthritis, and this group wanted to explore this question in psoriatic arthritis specifically. So they searched the PubMed and other research databases for any observational study of psoriatic arthritis that included the terms diagnostic delay and performed a meta-analysis, ultimately capturing 15 studies that were included in this analysis. Patients had to be diagnosed with psoriatic arthritis based on either CASPAR criteria or a physician-determined diagnosis. And ultimately, throughout these 15 studies that were included, they captured a patient population of over 22,000 psoriatic arthritis patients. Now, when we get to the actual results, this is pretty interesting. The pooled mean diagnostic delay of these patients was nearly 31 months. So that's patients taking over 2.5 years on average to get a diagnosis when all of these studies were looked at. And we can imagine just from a patient perspective how challenging that must be to be searching for a diagnosis for all of that time. They actually stratified by country of study, and so we saw actually quite a big range geographically, where rates varied from being lowest reported in India with a mean of about 6.5 months, then increasing for the US, the Netherlands, Singapore to around 1 year, and then highest reported rates of diagnostic delay from Spain at 48 months, China at 50 months, and Italy at 62 months. Of course, this may partially owe to the timing of the studies, the different ways diagnosis was determined in each study, and the specific methodology. But I think the takeaway here is that we're seeing a vastly different range of diagnostic time when looking at different studies around the globe. They also didn't just look at diagnostic delay, but also referral delays, finding that it took a long time for patients to even get to rheumatology, the mean being either 15 or 21 months, depending on the specific statistical analysis used. So it's taking these patients a long time to see rheumatology to get a diagnosis. How does that affect their outcomes? When they looked at radiographic changes or damage, they saw that delays were associated with an odds ratio of either 2.8 or 2.5, depending on which effect model was used. But the takeaway being that these diagnostic delays were associated with increased odds of a patient presenting with radiographic damage by the time they got their diagnosis. So overall, I think this is a really important takeaway for us as a rheumatology community to keep our eyes vigilant for these patients, to keep educating other specialties, dermatology, primary care physicians, to get them into our clinics more quickly, to decrease that referral delay, and then increase our clinical suspicion to decrease that diagnostic delay. Certainly, we also need better biomarkers, better tools to diagnose psoriatic arthritis if the diagnostic time is taking this long as well. So that's what I have for today. I'll be signing off and I'll see you tomorrow. Bye.